Welcome to Indian Anatomist. Individuals who want to pursue a career in medicine are welcome to check out the YouTube channel Indian Anatomist. Today's lesson is part of ongoing lecture series, and the subject is General Anatomy. 3.2 Anatomical movements can be sorted into two categories, general and special movements. The video that came immediately before this one, I discussed about the general anatomical movements. Please see description box for the link. In this video, I will discuss the special anatomical movements that are involved in specific areas of body. What is pronation and supination? Pronation and supination are unique to the primate's upper limb. It is a special type of rotational movement found in forearm that occurs round the longitudinal or vertical axis. Pronation refers to the internal rotation of the forearm, resulting in the posterior orientation of the palm from its normal anatomical position. In contrast, supination of the forearm refers to the lateral rotation of the forearm from pronation, resulting in the anterior facing orientation of the palm towards the anatomical position. Why pronation and supination is required? Without these movements, turning a screwdriver, or turning a key, or picking something is not possible. Just like the wrist has pronation and supination, the foot also has pronation and supination. All of these are thought to be special movements. The foot can turn inward, called pronation, and turn outward is called supination. Both terms have to do with how you walk or run, and how your weight is spread out. Supination is when your weight is more on the outside of your foot when you walk. Pronation means that when you walk, your weight tends to fall more on the inside of your foot. The protrusion and retrusion are special types of anatomical movements. Protrusion refers to the anterior movement, such as the forward movement of the mandible or lower jaw, lips, or tongue. Retrusion refers to a posterior movement, such as the act of moving the mandible, lips, or tongue in a backward direction. What is protraction and retraction? It is a special movement. Protraction refers to the act of moving a certain part of the body forward along a plane that is parallel to the ground. Whereas retraction, which is the opposite of protraction, refers to the movement that causes the prolonged part of the body to return to its initial position along a parallel plane. These movements will be seen in anterior and posterior displacement of the shoulder area. Dear medicos, most of the clinicians agreed that the protraction and retraction movements are same as protrusion and retrusion respectively. What is inversion and eversion? Another special type of movement occurs in the foot, especially at subtalar joint. The inversion of the foot refers to the rotational movement in which the sole of the foot faces inward or medial towards the midline of the body. This movement is considered to be the opposite of eversion. Now coming to the eversion. The foot eversion is characterized by the rotation of the foot in such a manner that the sole faces away, or lateral from the midline of the body. What is opposition and reposition? Opposition is defined as positioning something near or close to each other. Opposition is a special type of movement seen in the thumb. Opposition of the thumb occurs when the tip of the thumb or thumb pad comes to meet against or oppose the tip of other fingers from the same hand. Coming back to original position of the thumb is called as reposition. During reposition, the thumb and other fingers return to their original positions. At last, what is circumduction? Circumduction is a special movement, refers to the rotational movement of a limb in a circular path. Here is the example showing. Shoulder circumduction involves a mixture of shoulder abduction, adduction, flexion, and extension. Other examples. Circumduction can be executed with several anatomical structures, such as the arm, leg, finger, or foot. Dear aspirants, what exactly is this movement? Make your comments in the box. Dear students, I trust that you found this session to be enjoyable. In the forthcoming video, I will be addressing the topic of the skeletal system, within the broader context of general anatomy. Good day, all. Please like, share, and subscribe.